there will be a, oh, hold on, let me do something. Okay, there will be an email that goes out today with an evaluation and the slide deck. So please look for that. And next slide, a few last things that I have to tell you guys about our continuing education process is we are now going through the Texas Department of State Health Services. And so if you are seeking CEs, you must watch the complete webinar live, and you must complete the evaluation that will be emailed out. Of course, please, even if you're not getting CEs, do the evaluation because it helps us improve our training offerings. Next slide. And yep, that's about one more. Here is a list of the CEs that are offered through DSHS, but we, the Texas Campaign, we also offer continuing professional education through Texas Education Agency and community health worker through DSHS's, they have a separate department that handles that. So without any more from me, I am going to pass this over to Valerie and Healthy Teen Network.
Thank you, Melanie, and welcome. Good morning, everyone. Thanks for joining us. And it's so nice to see at least a few of you on your webcams. I am going to be your facilitator today, and we also have with us Ella Dorval-Hall, who is going to be working behind the scenes to make sure our tech runs smoothly. And like Melanie said, we are going to have some interaction. So this is not really, this is a meeting, not a webinar. So we are going to actually be working in some breakout rooms, and we're going to do some chats throughout. So I am going to turn it over to Ella just to get us started so that you are familiar with some of the interactive features that we're going to use today.
Hi everyone, my name is Ella. As Valerie said, I'll be working in the background to make sure all the tech is hopefully running smoothly today. So as Valerie said, this is going to be pretty interactive, so I want to go over a couple of different features on Zoom. As Melanie also said, I'm sure you are all familiar with Zoom right now, but if you go to the bottom of your screen, you can see on the slide that in the bottom left corner, there should be a mute button, and generally you can click the mute button to keep yourself muted throughout the webinar, except for when we're doing interactive sort of work. And then you'll also see that there's a participant icon, and when you click the participant list, a list will come up, and you can see at the bottom that there is a green yes check and a no check and a raise hand check. So I'm wondering if everybody right now can click the yes check so that to indicate that you're able to find the participant list. It seems like most people are finding it. If you have any trouble finding it, you can send me a personal message. So if you could now go ahead and use the raise your hand feature, which is also at the bottom, and use the raise your hand feature to indicate if you have worked with young people to teach sex ed in the past. Awesome.
Ooh, so many. Love it.
Okay, and now you can use the yes or no icon to tell me whether you've worked directly with youth in systems of care in the past. Okay.
Yeah,
Awesome.
good.
And finally, you can give me a thumbs up if you've done both of those things before.
And that's under the more button.
Okay.
Love it. Okay, so Corey, Jessica, Johnny, calling on you as my co-leaders today. Okay, so that should be everything. Like I said, if you need help, if you're feeling lost technologically, just send a private message in chat to Ella. And otherwise, I'm going to assume that we're all good to go. And I'm going to start with our focus today so that we can make sure we all keep everybody on time and use our hour the most wisely. So today our purpose here is to focus on why youth in systems of care can benefit from sex ed that's tailored for them, what is actually needed to deliver sex ed with this group, and then ways that that we can tailor sex ed for these young people. So what I want to do is I want to make sure that everybody's, if there are things that you are wondering about that kind of don't fall into those categories, please feel free to send those as chats to us, because we always like to hear, what's on your mind, what questions you have. We want to make sure that you have a chance to ask questions as we go throughout the training today. So we will try to answer some questions as we get them. And you can also raise your hand if you have a really timely question that just seriously cannot wait 2 more seconds. Please just raise your hand and we will get to you right away. Okay, so to get us started, I want to be sure that we're clear on who we're talking about when we say people in systems of care. So let me ask you this. This is our first chance to use the chat. I'd love for you to tell me what comes to your mind when you hear systems of care. Who are we talking about here? You can use the chat. Tell me, yep, definitely foster care, detention, child protective services, yep, CPS, yep, yep. Anything else that you're thinking of? These are all correct answers here. So we are talking about people in foster care. Sometimes, yes, it could be homeless. It could be homeless youth, although we know not all homeless youth are in systems of care. They may just be on the street. Yes, definitely foster care, juvenile justice, child welfare. So that's really kind of the easy part, right? The more complex question is, how did they end up there? Let's do another chat. Let's hear from some more of you. Tell me a little bit about what comes to your mind when you think about, or what circumstances or experiences lead a young person to be put into out-of-home care or to enter the out-of-home care system. I'm hearing abuse, neglect, absolutely, unstable family, LGBTQ youth, right on the money there. It's a huge one. So BCFS, HHS, foster care. I'm not sure what BCFS. So maybe Angelina, if you want to specify what that one is. High pregnancy, right? If somebody is pregnant as a young person, sometimes they end up in a system of care because they get kicked out of their home, or yeah. If they run away, they might end up in a system of care. Yep. Poverty. Yeah, deportation of parents, or any other caregivers, trafficking in the home. Yep. So all of these are reasons why young people might end up in systems of care. So thinking about some of these reasons, let's just take the next leap now and think about how might this translate into their need for sex ed that's tailored for them. So this time I would love to have a couple of volunteers raise their hand and maybe suggest some reasons why, based on this, that they might need sex ed that's tailored for them. There's no real, this is not a test. Great, Felicia? Let's unmute you. Ella, if you can unmute Felicia, or I can unmute her. There we go.
No one is giving them that information.
Yeah, they're not getting it anywhere else, right? So they're often not in school, right? And they have limited opportunities. They might not have trusted adults who can give them that information. Yeah, thanks, Felicia. Tracy, tell us what you're thinking.
Hi, yeah, I was kind of thinking the same thing. We we hope and wish that there were stable parents and family members and role models for young children to talk to learn about these things. But in an unstable environment, that's certainly not the case.
That's right. Absolutely. Looks like Jessica also has her hand up.
Hi, can you hear me?
Yeah.
Hi. So what I was thinking is that this particular group of children a lot of times are in the higher risk population of our youth, just because of some of the circumstances they've been involved in. And so this information needs to be tailored to their circumstances. Some of these children, so someone brought up homelessness, they have been on the street. So they may have already had transactional sex encounters and things of that nature. When they come out of the system, they may be going back to, I'm sorry, my baby's not feeling well. They may be going back to that environment. And so sometimes sex ed doesn't look like, oh, well, don't have sex, or here's a condom. They may not even have that type of power in the relationships that they're engaging in, or that are being forced upon them. So trying to just help them, meet them where they are in their sexual health journey, and giving them the tools and resources to try to protect themselves as best they can, because it's not so straightforward all the time with these types of populations.
That's absolutely right. And yes, I see there's definitely some other, let me take two more. Let me just ask, I appreciate that you're absolutely right. Mary or Mari, did you have anything else that you wanted to add that wasn't said there?
I guess just access to regular birth control if they do have the power in that relationship to decide if they're going to have sex, like access to birth control pills or an IUD or things like that.
Yeah, absolutely. Absolutely. And then Anna Kay, let me just ask you to share, and you're muted. Hold on. Can you unmute Anna Kay? Oh, there we go.
Yeah. And I was going to say just making sure that it's trauma informed, not that all sex ed shouldn't be, but I think that, the reality is with this population, it has to be, there's not only a need for the content, but then also for the environment that it's in and the resources to be there if there's triggers or other results of discussing some of these things.
Absolutely. So yes, I absolutely appreciate that. And we are going to get into that a little bit more when we talk about what that could look like and how we might do that tailoring. But in terms of just thinking about the why, at this point, if you want to just unmute or click on the slide, Ella, I think they can see some of those reasons that we listed here. Just go back to this one here is, we know that we mentioned already that they have higher risks. There's things going on in their lives that put them at higher risk of an unplanned pregnancy or sexually transmitted infection. We know that it's documented that they're often in situations where they're having sex at a younger age, and this is often not by choice. There are many times when they're having non-consensual sex or transactional sex, as it was mentioned. We know that they are exposed to violence. They've been on they may have been on the streets, or even if they haven't been homeless, they may find that there's violence in the home. We know that they often miss out on that school-based sex ed because they're either moving around so much, or they just are not in school at all, or they're getting schooled from a detention center, and it's a pretty limited model of what they offer. And then we also talked about how they might just lack trusted adults, but also just lacking role models in general. And that could be role models for people who are, doing things with their lives that, might set people up for success, but also just role models that can teach them about communication and negotiating power in relationships. So there's a lot of reasons why we know that that it's a good idea to acknowledge their need for tailored sex ed. So part of the solution is a solid sexual health education curriculum that takes into account those factors, and that also helps them build skills to take control of their sexual health. But another part of the solution is knowing how to deliver this kind of curriculum effectively with this population. So it's not just enough to have a curriculum that's, tailored, but it's really having those facilitation skills that takes into account some of the things you all mentioned, like the trauma that they experience. So we're going to talk about both of these, and we're going to start by talking about the facilitation skills part, because no matter what curriculum you might use or set of lesson plans, those facilitation skills can cut across any curriculum. And I recognize like we're just like touching on the surface because this is a short session. It's not a full training, so bear with me. And you know, we know that we need to, we can have a whole training on these topics alone. So what I'm going to do now is I'm going to create a little space for us so that we can share our collective wisdom about what we mean by high quality facilitation. So in a minute, we're going to put you into small groups and for about 5 minutes. And your challenge is to come up with at least 5 characteristics of a good sex educator. Don't think about, just for a second, I'm going to have you put aside the youth and systems of care for the moment. Just think about the general characteristics that anybody who teaches sex ed needs. So when you get into your groups, make sure that you just assign a note taker and a reporter. And in a moment, what you're going to do is Ella's going to give you, you're going to see a dialog box, and then you just click on it to join the group. It's super easy. I don't know how many, if you've done this before, but it really is easy. When you're in the group, you can see each other if you have your webcams on. It's nice if you can do that. And if you need help, there's also going to be a button at the top of your screen to ask for help, and one of us can join your groups. Make sense? Let's see a few nods. I see a few nods from those of you on webcams. It's so nice to see a few faces. It's great for us. All right, so Ella, go ahead and create those breakout rooms. But folks are coming back in. Okay. How was your breakout room experience? Good. Y'all are Zoom professionals. Look at Johnny Rodriguez with his thumbs up and everything. Nice. All right. Most folks are coming back in now. Oh, good. I'm glad you found the feature was easy to use. I was hoping this time that everyone's kind of getting ideas for ways to make their virtual learning a little more engaging and interactive. All right, I think we're all back in. Looks like no, the participant list is still growing. No, I think we're at our peak now. Okay, so what I would love to do is our reporters, if you were a reporter in your group, could you raise your hand, please? We may not have time to get to all of you, but I want to make sure that we get to at least some of you. And this time I'm going to start at let's go to Jessica. I'm going to unmute Jessica.
Okay.
So Jessica, tell us about your top 5.
Okay. Oh goodness. We did not we ended up with more than 5, so I don't want to decide whose is more important. I'll just read really fast. So we had patience, a good listener, outgoing, understanding, and sex positive were the first 5 that came.
Okay, Ella. So Ella's scribing this as we talk. So understanding, sex positive. I love that you said sex positive. What was the other thing?
The other one was outgoing.
Outgoing. Those are all, yes, they can all be very helpful, right? Even if you're not naturally outgoing, it can be very helpful if you try to channel that when you're doing sex ed. Absolutely. Thank you, Jessica, for that. Tell me if I'm pronouncing this correctly. Cece?
Yes. Yes, that's perfect. So we mentioned a couple of the same things that Jessica mentioned earlier. We also talked about being empathetic.
Okay. What were the 2 things, just out of curiosity? What were the 2 things you mentioned?
Patience and also outgoing. We kind of framed it as being engaging.
Got it. So you see how Ella's checking off. So we all want to see which ones kind of rise to the top. So, all right, so we've got engaging, empathetic.
Culturally responsive. Avoiding making assumptions. So instead of making assumptions, being curious about where some or comments are coming from.
Yep.
And being knowledgeable and up to date with the changing landscape around reproductive and sexual health.
Okay. Excellent. Thank you, Cece. All right, so let me go to, is it Mari or Mary? Let me get you unmuted. Or Ella, if you can unmute. Mari. Oh, I keep trying to unmute you and then you end up muted again. Oh, there we are. Is it Mari or Mary?
Mari.
Mari.
Yes. So our 5 were inclusive, intersectional, flexible, medically accurate, and trauma informed.
And just for anyone who might not be aware, I know we could have a whole other training on this one too, but when you just say intersectional, can you tell us?
Taking into account just like the different populations that you might be working with and the issues that they face as, you know, as part of their identity.
Right, so not necessarily assuming that everybody who fits into one category is the same, because people have multiple identities. So they might be, you know, identify as Black, but they might identify as trans or identify as straight, and those two people will have different, they'll bring in different concerns or different experiences into a training. So thanks for that, Mari. Let's go to Anna.
So some of these are gonna echo other ones, but okay, so open-minded and non-judgmental. Also trauma-informed. Let's see, I'll try and do some new ones. Resilient / creative problem solvers. And up to date with current info and stats. And then straightforward and inclusive. That was one more.
Okay, inclusive. So we heard inclusive again, we heard trauma informed. It's kind of a lot, isn't it? Sounds kind of daunting. However, I think that you're right on the money, that these are all really great characteristics. Let's think about what, if we had to add anything to this list to address the needs of youth and systems of care. Are there any qualities on here that you think are missing, that are really critical if you're going to be working with young people in systems of care when you look at this list? And maybe that there isn't anything missing, because this is a pretty good list. Okay, Johnny Rodriguez, you're making me laugh. The birds are calming. Are these the birds in my background? I think so. I'm glad to hear it. It's not a tape. It's for realsies. All right, so tell me in chat, what else is there anything that you feel that is missing here that you might think also about, you know, what we said about the young people in systems of care benefiting, like why they need sex ed that's tailored for them. Ability to work in a group or as a team, yeah. Loving working with youth. Okay, so Brooke, I'd love to hear a little bit more in a second. Acknowledging atmosphere. So I'm guessing that you might mean, you know, recognizing that here we are in a detention facility, or here we are in a shelter, or maybe if you want to just add that to chat, Brooke. And Ella, if you can just clear the raised hands so I can make sure we're not getting any, that those were just from last time. If you did actually have if you raised your hand after and we cleared you by mistake, just raise it again. Okay. Yes, having the language, having the sense of humor and being comfortable and being ready with resources and tools. Yeah, I think all of these are additional qualities, and I think that they could probably apply to everyone, but yeah, I really, Bryce, able to cope with the anger and the hostility for sure. That's when you see a lot, you know, with populations like this. Anything else? This all looks like a pretty good list, but I want to talk a little bit about respect and value. Yep. So let me just see. Oh, Brooke is clarifying what she meant. So, or what they meant. Making sure people feel heard in an atmosphere. Yeah, seeing each student rather than just the ones that speak. Yeah, because they're going to be young people in systems of care may have lots of reasons why they're not participating, just as general students might be, right? Okay, these are all really great suggestions and ideas. I'm going to talk about a few that have come up for us in trainings and as we've worked on this curriculum with young people in systems of care. But yes, thank you, Anna, for the inclusiveness pertaining to LGBTQ. And a lot of these are things that could apply across the board, right? So there's a few things that I want to talk about as they really apply especially to young people in systems of care. And so one of those, I'll have you go on to the next slide, Ella, when you get a second. Except I think we need to go back to that last slide and maybe get rid of the, yeah, there you go, with the annotations. So one of the things that's come up a lot is that we want to help these young people feel in control. Tell me in chat, why might that be? Or actually raise your hand. Would you raise your hand to share? Why might that be so critical to this population? I got a green check. Let's have a raised hand.
Okay, so this is
Oh,
Jessica.
we got Jessica.
When just speaking from my experience in the detention centers, so much is out of their control. So even the general population of teens, a lot of times don't feel as respected as heard. They're in a part of to transition in their lives where they feel really grown up. They feel like they know a lot, but not a lot of adults respect their opinions because they get told you're still a child, stay in a child's place. And even more in the detention center where they get told when they can stand up, when they can sit down, where they can be. And so one of my greatest feedbacks that I received was when a group of the boys told me at the end, they said, Miss, thank you for treating us with respect. Thank you for treating us like regular kids. And I don't know, I've never sat in on anyone else's programs at the detention center, but I don't know if other people were coming in and treating them like you're in the juvenile justice center. I'm going to treat you like a criminal, but they just kept saying, thank you for treating us and talking to us just like regular kids and with respect. And letting them give the feedback and have a little bit of control in how the class worked. I let them kind of work together to set our class rules and the respect boundaries. I let them come up with it so that they would take ownership of it and feel in control of our classes and our sessions.
Absolutely. Thank you so much, Jessica, for that. Tracy, I'll ask you to share some of your thoughts.
I agree with Jessica. I'm a public high school health teacher, and just validating every student from the outgoing, confident kids to the quiet, introverted kids is letting them know they're respected without earning it, just automatically giving it to them. And then it's a safe environment and they feel able to be honest with you. So I agree.
Absolutely. Yeah, let's take one more quick comment and then I want to just move on. Anna.
Yeah, so I teach life skills, PAL classes. So all of my students are foster youth, and often we're teaching in residential treatment centers and shelter. So, you know, we have, you know, there's a range of things going on, and I've experienced having youth even with trigger warnings, being triggered and then having reactions and behaviors, including self-harm. And so there's, in those situations, more than just an educator, but also kind of have to be very trauma informed and helping them to cope with everything that comes up.
Yeah, absolutely. Yeah, all of these are really useful and important insights. So some of the things that we often talk with facilitators about is, helping them understand what they can expect from you. And so, this is often one of the things you can do is do this through the group agreements. So one of the things we've done is actually we've moved away from just having group agreements to expectations. What are the expectations that we should have, that you should, what can you expect from us? And what do we expect from you in terms of this relationship, how you're going to treat each other, things like that. And so some of the things that you can use if you're thinking about those expectations, this also enables you to be part of that group agreements. When people do group agreements, they say, well, let the young people decide on them. And then if you don't get the ones you want in there, you end up sort of taking over the process. So this way you get to say, here's some of the terms of the deal that I can see that from my end, and let's talk about now what it is from your end. So giving them a sense of what they can expect from you. So here's some of the ideas that have come forth from some of our facilitators. Let them know to expect in advance that if there is a hurtful comment, that you're not just ignore it, right? Like you might, a toddler who's trying to get attention and saying a curse word or something, you're not going to just ignore it. You're going to actually address it, because it's extremely important to address a hurtful comment, because if you ignore it, people think that, it's okay, or that person just feels less in control because they feel like they don't have any recourse because you haven't addressed that hurtful comment. One of the other suggestions we have is that you tell young people that you are going to, even though there might be some discomfort on your part or theirs, because you're talking about sensitive topics for one, and secondly, they may have had experiences that make them feel uncomfortable when they're talking about these topics, that you're going to work through it, and you're going to work through any discomfort that you personally might feel. And the reason is because this is so important, that it's important to work through it. And by doing that, you're not only enabling this more inclusive environment, but you're actually modeling what you want them to do, right? You want them to talk to their partner, even though they might feel uncomfortable. Talk to a trusted adult, even though they might feel uncomfortable. So it really serves two purposes. If you include that as part of your day one, lesson one, before you even get started, you say, this might be uncomfortable and that's okay. We're going to work through it. Letting them know that if they ask a question, whether that be in the moment or anonymously, that you are going to do your best to answer that question. And for the same reason, because you're demonstrating that they have control. If they ask a question, they are going to get an answer. Again, we could have a whole training about this as well. This is kind of scratching the surface. And the other piece of this that I want to spend a couple more minutes on is that you will avoid making assumptions. So you can say that to yourself and say, yes, I'm going to avoid that, but actually explicitly telling young people that you are not going to be making any assumptions about them. So I just want to ask for your thoughts in chat about why it is that you might want to explicitly say that to them versus just doing it yourself. This is your chance to think. Why might you bother to do that? Ella, could you clear the raised hands? Okay, because I think those were from before. If you want to do it by raising your hand, you can do that as well. To be transparent and accountable. Yep. To reassure them. Yeah, absolutely. It can help with dialogue and help young people feel more comfortable. Yeah, I love this, like Jessica, yeah, if I don't say it out loud, they might assume that I'm thinking the worst of them. Absolutely. Yep. Ooh, I like this one, Peggy, because they might make assumptions about you. Yeah, I mean, they might. I think that we can't necessarily control what assumptions they're going to make, but if you tell them you're not going to make assumptions about them, it might put them in a place where they feel more comfortable and receptive to what you've got to say, right? And it does make you more accountable for sure. So what might some of those assumptions be? Let's take another minute in chat and tell me, what are we talking about when we say making assumptions about them? What are some of the assumptions that get made that impact sex ed? We've all done it. What assumptions might we make about young people that would have a big impact on how we teach sex ed, or could? If you could tell me in chat. Yeah, that they are, right. Gender, sexual orientation, we assume everybody is the gender that they look like on the outside. We assume people might assume people are straight, everyone is straight, because they haven't told you otherwise. Assuming that they all are having sex or that nobody's having sex. Corey, yes, another assumption is that they don't care about their sexual health, or they don't care about other people. Yeah, absolutely. These are all really common assumptions. So, and we talked about why that is important to not make those assumptions. So this is something that you can add, you know, to say, I'm not going to make any assumptions about you. I'm not going to assume that everybody is straight. I'm not going to assume that everybody is the gender that they, you know, look to be. I'm not assuming that all of you are either having sex or not, or that I'm not assuming that all of the sex that anybody might have had is by choice, right? I'm not assuming that everybody is, yeah, and Jessica, that's another good one, that if they're not participating or speaking out, that they're not actually listening or they don't care. Yeah. That's the kind of, that can be a really hard one to employ in practice, because it can be, you know, students are good at doing, our young people are very good at looking like they don't care, when in fact they do. So I think that one of the most, and I'll go on to the next slide here and, you know, say that really one of the most important assumptions that we want to acknowledge is that really many of them, if not all of them, have experienced some kind of trauma in their lives. That's often what has put them there in the systems of care, in a system of care. And it's really important to make that explicit statement that is acknowledging that. But it shouldn't end just with that statement at the beginning. There's things that you can do throughout the time that sex ed's getting delivered. And so some of these would include things like, you know, standard practices, like not forcing any interaction with objects or people. So what might I mean by that? Let's have a quick chat. Tell me what I mean. What would be an object that somebody would have to potentially interact with during sex ed? Yeah, so condom demo, right? A demonstrator. So somebody who has to interact with a wooden demonstrator model that's shaped like a penis might find that to be traumatic, right? So we cannot force that kind of interaction. Asking before you touch someone. A lot of these are pretty standard, but it's just important to reiterate them. Having that plan B, so when somebody is triggered. So with the curriculum that we offer, Power Through Choices, we recommend strongly that people have 2 facilitators at all times. So that's really important, to be able to have that second facilitator to maybe manage a situation when somebody just is triggered or something happens and they just need to go off with that person, and the other person can manage the rest of the group. Another thing that you can do is to tell them what's coming, right? Now let them know what you're going to be talking about that day. At the end of your session, what's coming up next time, you know, really knowing that, letting them know what to expect is goes a long way towards making them feel more comfortable. And then finally, treating them as more than their trauma. You know, I heard somebody say at the beginning of the session that they all like, thank you. I think it was Jessica say, you know, thank you for treating us like human beings. You know, these young people don't just want to be treated like victims. We hear time and time again that they actually do, you know, having that sense of humor, being able to connect with them about just everyday things can really maybe be the only time they get to feel normal, right? If they're in a detention center, if they're in a group home, they just might have limited opportunities to just feel normal. So providing that can be really helpful. So there are, let me just go on to the next one. Yeah, so a few other things to just consider when working with these young people. We know that some of them have been, some of these have already been mentioned, but knowing ahead of time what kind of topics or behaviors might be particularly challenging for you, and really having a plan in place for what you're going to do if you are going to encounter those challenges. So I think if you're new to the training game, it's really like talking to facilitators that have been around and talk about what was challenging for them. Or if you have that experience, thinking about what you did to overcome those challenges and sharing that with some of your other colleagues can be really helpful. Avoiding the shaming messages, right? So nobody wants to say they're shaming people, but I think it's sometimes we don't even realize that we could be shaming people. So for example, teen moms in particular can often feel shamed during discussions about the consequences of pregnancy, right? There's some programs out there that really like go to great lengths to talk about, you know, there's a one where there's a, I don't know if any of you have used the one where there's a letter that the baby writes to the mom, and it's just, it's really like a can be a very traumatic thing for young people who have already have a child. So another one is to learn as much about the group as you can before you start sex ed. So who's had conflicts with who? You know, try to stay aware of anything that might be brewing between participants, because this is really common, especially in detention centers. And something else that you can do to really help these young people is to give them opportunities to help each other. So there's a lot of research out there about how good we feel when we help other people, and a good sex ed curriculum can provide those kinds of experiences for participants. And you know, this one goes without saying, to be yourself. You know, don't try to be one of them. Don't try to cover up your discomfort. You put yourself out there, and these young people are going to appreciate your honesty. And we know that they have the giant BS radar. So, you know, just don't even try. They will get you, they'll, you know, figure you out. So just, you know, try to be yourself as best you can. So going back to kind of where we started, we talked a little bit about the importance of a high quality sex ed curriculum, right? That's tailored for these young people. So I'm just going to spend a couple minutes talking about this, the Power Through Choices curriculum, because that has an evidence-based curriculum that has been tailored for this population. Let me just get a quick show of hands though, if I can. How many of you all have heard of Power Through Choices before you signed up for this session? Would you just do the raised hand? Okay, not very many, as in nobody that I'm seeing. Okay, Anna Kay, you're the only one. All right. Okay, so let me tell you a little bit about it. This isn't really going to be an infomercial, but I just want to make sure that you understand what it is and how it might be helpful to you. So Power Through Choices, if you go to the next slide, Ella, it was developed in the mid-90s by social workers at the University of California, based on, they did focus groups with young people, and they did interviews with social workers. So then it was actually revised in 2010 by Oklahoma Institute for Child Advocacy and the University of Oklahoma. They got federal funding from CDC to do this. And the main changes they made were adding sessions on reproductive health basics, like, you know, male and female anatomy, and STIs. So some point, the Oklahoma team wasn't able to continue to support Power Through Choices. They moved on to, took a different direction, and they asked us to sustain the program. So when we took it over, we updated it to make it more trauma-informed, more inclusive of all genders and sexualities, and medically accurate. So the curriculum itself covers a wide range of topics. And it talks about contraception and STIs, the kind of standard stuff, but it also allows for skills practice in communication with both peers, with partners, and with adults. And it includes things like goal setting and planning activities. And there's lots of opportunities for them to give advice to fictitious people and to reflect on what they want for themselves. It's an evidence-based intervention, which means it's gone through a rigorous evaluation and it's been shown to have an effect on behavior. And this slide just summarizes some of the main effects. You can see the participants had lower rates of sexual activity, they were more likely to use birth control, and they were ultimately less likely to be involved in a pregnancy. So, my goodness, we're almost up to our hour. What I want to do is tell you, open it up now and open it up to some questions about Power Through Choices. I will just tell you that, you know, since we did this presentation or put this proposal in for the live meeting that was supposed to happen, we have started working on a live virtual version of this curriculum, as well as a live virtual training. So right now it's, you know, available as a face-to-face, but we are hard at work on that and expect to have something over the next couple months here, a live virtual version of it. So ask away. Tell me what you're wondering about Power Through Choices. Okay. Seriously, no questions? Come on, somebody has a question? Chat, a comment? Ella, are you seeing any raised hands? I'm not seeing any raised hands. Johnny Rodriguez, man who likes my birds. Tell me.
Am I unmuted? Yes, I'm
You're
unmuted.
unmuted.
So I work with Dallas CASA, Court-Appointed Special Advocates, and the information here was just awesome. I would love to see an opportunity and or information sent to our training person to maybe get this out to our advocates and or to staff in and of itself.
Yes, absolutely.
Is there any room
Yes.
or how would we go about to get contact with you all there? I'm assuming in Austin, and maybe trying to get somebody up our way.
Absolutely. So I'm going to send a chat. So I'm going to put my email in the chat, and you all can email me directly if you want to know a little bit more about it. Okay, so I've got two questions here. How can we access the curriculum? So email me about it. It is, you know, like I said, we have several options around training. Is there an abbreviated version of the curriculum? No. Sorry, Anna. It's 10 sessions, 90 minutes in length. And that really, you know, what we know from the evidence is that there's no, it's kind of like what they say about losing weight. Like there's no real quick fix. It's like diet and exercise. I mean, you need multiple sessions, you need skills practice time. So there really isn't one that we know that is evidence, that has evidence behind it. No, Lauren, it is not strictly abstinence. It is a comprehensive curriculum for sure. So, but you know, abstinence is always presented as a healthy choice. It's not, you know, glossed over. It's absolutely presented as a choice, but it is a, it's also providing full information about contraceptive options. There's also information in there about how to access what you should look for in a youth-friendly sexual health provider, and like gives them practice calling a clinic. They don't all call a clinic, but they experience somebody practicing calling a clinic and the questions you might ask, things like that. Oh, Anna, I'm sorry. Yeah, 2.5 hours to cover all of sexual responsibility. Yeah, isn't that great? Like, you know, I often experience this as a trainer. They'll say, well, teach all my facilitators to be rock stars and I'm going to give you 30 minutes, you know, training. So yeah, you know, again, email me if you want to talk about, you know, options. But again, with Power Through Choices, you know, I wouldn't say you'd get very far in 2.5 hours, but maybe there's ways to negotiate or to like find extra time or, you know, work with other folks. I mean, oftentimes what happens when Power Through Choices is implemented in these settings is that people realize that it actually has spillover effects on youth behavior, on other, and so we found that people, once they see it get implemented, they want to keep it going, and there may be more, you know, if folks know that other organizations or other systems have implemented it successfully, they may be more interested in allocating more time for it to happen. They might see it as more of a priority. So I would always advocate for trying to make it, you know, more of a priority. So thank you, Johnny, for your validation of the sounds of nature. I had no idea how much how important my birds were, or how they were being heard by everyone. So if there's nothing else, I'll say thank you to everyone. You have my email in the chat, so get in touch. You know, we know that we're living the pandemic life, but as we start to get more information about our virtual learning, we'll make sure that Melanie has that access, and Melanie will, I'm sure you'll share that with your networks as well.
Yes.
Yeah.
And just a final word, I echo what Valerie says. Thank you for joining us. We will be sending out the evaluation and recording of this session later today. And remember, if you're trying to get CEs, you will need to complete that evaluation. So thank you.
Thank you, everyone. It was nice to see a few faces. Have a good rest of your day.
Thank you, everyone.